Okay, aku dah streaming. YouTube dah jalan. Siapa share kalender? Itu tanggungjawab dia. You are live on FB already. Ni modul G F.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh, and a very good morning to all the participants. Welcome once again to day 7 of 23rd Medical and Health Research Week by Faculty of Medicine, the National University of Malaysia. So with us today in this webinar is Associate Professor Dr. Jemimah Cik Hamzah. She will walk us through on the topics and overview of systematic review. Before that, let me just read through the biography of Associate Professor. Dr. Jemimah is an associate professor and senior consultant in departments of ophthalmology, Faculty of Medicine, UKM. She graduated in 1996 from UKM and served the Ministry of Health for 3 years. She later joined UKM as a training lecturer and obtained her Master of Surgery in 2003 from the same university. She pursued her PhD in University of Aberdeen, which practicing as a glaucoma fellow in Aberdeen Royal Infirmary, and she graduated in 2012. She did her attachment at the Belfast Reading Centre and the Central Angiographic Resource Facility Imaging Centre in Queen's University Belfast, Northern Ireland. Her main research interests are health services, research in ophthalmology, particularly outcome research in glaucoma and diabetic retinopathy, as well as delivery of service through Internet of Things. Apart from that, she has served on many national ophthalmology committees and involved in many national ophthalmology conferences. So before I pass it to Professor, if you've got any question, you can just leave it in the Q&A and chat section at the bottom of the screen. And without further ado, over to you, Associate Professor Dr. Jemimah.
Assalamualaikum and a very good morning to everyone. I am actually tasked to give you a lecture on systematic review and overview. I'm actually an ophthalmologist, as the moderator have already discussed, but I'm also the head of clinical trial units, a unit in the Faculty of Medicine who deal with clinical trials. What is the difference between the systematic review and the traditional literature review? And then we go to the meta-analysis, and then where to get help when you are doing the systematic review. Okay, I think this is actually a very, very common situation. Look at this lady is actually looking at tablets for menstrual pain. And they were just talking about this tablets, and they're not sure which tablet is actually very good for menstrual pain. So in a normal situation, what is your next step actually? So of course, the steps is actually to search for evidence. And how do you search evidence? Okay. So first, you search evidence from the internet, okay, whether it's a Google search, but the evidence is always in our situation. The evidence is searched in Department or Medline. But if you see, there's a lot. If you search medication for menstrual pain, of course, there is a lot of studies done over the years. So if you look, there is 50 million science paper published since 1665 in 2009. And if you think about it, approximately 2.5 million new scientific papers are published each year. So how do you actually look which tablets are better when you compare? Because if you look at the evidence, it will be comparing from one tablet to the other. And some papers will compare a few tablets to each other and which one is the truth actually. And there is always an easier way to process the information. So what is the easiest way? Is to summarize existing studies on a specific topic of interest. This is important because if you have the summary, then you know what is available in the current situation. And then the next best thing is you to appraise the evidence from the study. So you look at the validity, which is closeness to the truth, and applicability, which is useful in clinical practice. And then you apply the evidence to the clinical practice, which you look at the clinical expertise and the patient preference, and then you make the decision. So this method is very good in identifying areas where available evidence is insufficient. So in people who are starting to do research, literature review or systematic reviews can give you gap in knowledge, okay? And it can actually teach you what is known and what is unknown and areas of controversy in that area. And the best thing is ensure no replication of existing knowledge. So your research is novel. So this is very important. And with this literature review, you can help to prepare for future studies. And how do you do that? You prepare your study proposal and produce a rationale and justification for future study. And one thing, when you actually do a lot of this searching for evidence, you can identify other researchers in the field of interest. This is networking 101. So if you see, when I actually talk about literature reviews is actually a big area. And the usual one is the traditional reviews, the narrative reviews. But we have an entity called systematic review, which is overlapped with the traditional reviews. And we have also meta-analysis when it can be as its own and it can overlap with the systematic review. And we have another entity called meta-synthesis, where you synthesize the data available. Okay, so we look at literature review. This is common. Literature review is very common. You can actually, this is easy to do. It's a traditional narrative review. So you have a summary of study without any synthesis of information. So example, when you have a literature review, you have a topic, diabetic retinopathy, medicine in diabetic retinopathy. You collect all the evidence and the evidence will say, okay, metformin, we have insulin, and all this, it is actually compiled for you for your easy reading. So these reviews are actually aimed for theory development, theory evaluation, and then you look at the state of a particular topic. You can identify problems in a particular research area and provide a historical account of development of theory and research of a particular topic. Okay. So this is an example, as I say, diabetes mellitus review. The method is actually very easy. You identify your question and then review the literature and then critically analyze, so far critically analyze, because you take all the information and you try to synthesis. Synthesis means you actually divide it. If you have a diabetic mellitus review, maybe you want to divide it into management, you want to into treatment, you want to divide it into the other thing is investigation. So when you have that, you can actually write your review and you can have your publication, which is easy to do and still acceptable at this age. Okay. However, in literature review, the limitation is because you're doing you're doing the search according to what you think is important. So you randomly identify and analyze the studies, and you don't report the methods of how you search the literature or reporting of the study result. Therefore, the methods cannot be replicated. It may be subjective, it may be biased, because what you can do is actually trying to get your studies into the literature review, or rejecting others that you think it's not plausible or feasible. Therefore, you may reach opposite conclusion, but miss small but potential important effects. Okay, so you can have bias, actually selection bias, in doing literature review. Now, systematic review is actually introduced by Cochrane, and what we actually have is different from literature review because it is a systematic approach of the literature review. So you have a strict methodological rules that describe in detail to make them reproducible. So it focuses on a research question. It has a protocol. It has a predetermined and elicit method. You have predetermined search methods, predetermined inclusion and exclusion criteria, and predefined data analysis. With all this, we have that protocol. All this reduces the bias because you identify your studies systematically. And then the beauty is actually you appraise the included studies, and then you critically appraise and synthesis the included studies. And when you have enough power or enough studies which are quality is good, you can statistically combine all relevant studies as if you're doing a big study. And the beauty is it's not only in Malaysia, you can actually combine all the studies in the whole world. So your studies will be very powerful. Okay, so you look at this, the methodology of systematic review. It is just the same as doing other studies. So you have to have your protocol with a review question, and then you define your inclusion and exclusion criteria. Then you have your search for your studies using at least two by database, and then you select the studies that meet the inclusion criteria. And then this is an additional step compared to the other studies. You assess the quality of the included studies using checklists or tools. And then you extract the data, you analyze and present the data and interpret the result. Okay. So systematic review is just a filter. What you have is all the information and it filters down, and it is actually a good quality. If it's actually done correctly, it is a good quality review. Okay. So example, usually in systematic review, you want to look at the effectiveness of a drug or a behavioral trials. So it is usually involving the randomized control trial. Randomized control trial, you know, is the highest, it is actually the best trial, best study design where you have experimental. So the randomized control trial will eliminate selection bias, and you can actually see there is enrollment of the patient where it is allocated into two groups and they have follow-up and analysis. These are the best studies that you can actually put in the systematic review because it will give you the truth of the research question. Okay, so systematic review is very important because when a person does a systematic review, it actually try to reduce a large quantity of information into something that you can actually look and refer very fast. Okay, it integrates every single information which is important to the stakeholder because it takes views of the patients, the clinician, and the policymaker. Sometimes it formulates guidelines and legislation concerning the use of certain diagnostic tests and treatment strategies. And it is efficient scientific technique. So it shortened the time between the discoveries and the clinical clinical implementation. Okay. Again, let me go back to when you say how do you quality assess the patient, quality assess the systematic review. Remember, the systematic review is a study of studies. Actually, you look at the studies rather than the patient. And the best study design will be the randomized control trial. And when you quality assess, it is the bias in the study. So I'm looking at the most easiest bias that you can identify, which is in the randomized control trial, where you look at the allocation concealment and the sequence generation of the randomized control trial. So if the study has that, then it can be graded into good or poor. And then you look whether the participant and the personnel is blinded. Okay, if it's not blinded, that it will cause observational bias. And then you can actually see the blinding of the outcome assessment. Okay, and then whether the data is complete or incomplete. So you can reduce the attrition bias, or not reduce, overcome the attrition bias. And then you can have another one, a selective outcome reporting, which is common actually. So when analyzing the systematic review, you're analyzing all these bias, whether it's present or not, and whether this study is a good study or a poor study. But it's not that easy. Okay, so again, this is what you're looking for any selection bias, any performance bias, any detection bias, any attrition bias, and any reporting bias. I will not go into that. I'm sure in this research week, you have already discussed about all these biases, and you have to apply in the systematic review. Okay, so this is an example of a systematic review. It will always have the title will always have a systematic review. So if it's a literature review, it doesn't have a systematic review inside the title. Okay. So what's the difference? Okay, you said, oh, this is more or less the same actually. But traditional reviews are very subjective or biased, but systematic review, they use systematic methods to control bias. Traditional narrative reviews do not present explicit method for searching literature and reporting results of the studies compared to systematic review. And you cannot replicate narrative reviews. But systematic review, you can replicate. Example, when you have a systematic review, a person does a systematic review, it will tell you from which year to which year there is the search was done. So you can actually just pick up, after 5 years, you can just pick up the methods and actually do your systematic review. And you have a systematic review, and it's easy for publication. Okay. That is systematic review. Systematic review is actually looking at the reviews systematically, searching it, and then analyzing it. Okay, but what then when you have a good quality studies? You want to know what is the result of the study. You want to know effectiveness of a treatment. So you can actually do meta-analysis. Meta-analysis is a statistical procedure. So you have your systematic review. Additionally, you can have a statistical procedure that combine all studies. And this is very powerful because you integrate several independent studies and you can have a quantitative synthesis. But remember, when you actually do a systematic review, if your method or your protocol is totally wrong, and you collect all the garbage in, and then you have all the garbage out. So your systematic review, your meta-analysis is actually dependent on your systematic review. And people is confused what systematic review, what is meta-analysis. Systematic review is you can actually do your systematic review and finish at that, and it's always descriptive. But meta-analysis is the quantitative part of the systematic review. So here I reiterate, when you have identified your studies, okay, and you have screened and you look for eligibility and you include the studies, okay, this is called systematic review. Okay, sorry, systematic review. And if you have good quality studies and the studies are heterogeneous, then you can do meta-analysis. But even it is heterogeneous, you can actually do some statistical analysis to a statistical method to actually do your systematic review. Okay. So again, to reiterate, the systematic review combines several studies. And you have a statistical synthesis that results that is resulted. The beauty is if it's a larger trial, it is weighted more compared to the smaller one. The participant is compared among the studies where you retain the randomization. So you can actually detect small effect. So if you think about it, it's very powerful because you combine Malaysian study with a US study, with a UK study, and with a European study, or probably an Australian study. And your result will be very powerful. So you can have 10 patients around study one, but another study will have 1,000, and then so on. You can have probably a 10,000 patients when you do a meta-analysis, depending on the research question. Okay, so the relationship is between the systematic review and meta-analysis. Systematic review just identify and appraise the studies, whether it's a good quality study, and if it's good quality study and homogeneous, then you can do a meta-analysis. And then important thing, it will provide you an estimate of the treatment effect. So you can actually know whether the health intervention is effective or not. So you can actually have a OR or a relative risk, which is combination of all the studies, and that will be very powerful. Okay. So the systematic review is very powerful in terms it's very objective. It increases the number of subjects, it increases the generalization of the finding, and improves the quality of research. Okay, so therefore, when you look at the hierarchy of level of evidence, the systematic review is the highest evidence there is. Okay, and one of the systematic review that you always look at is the Cochrane reviews, especially in medicine. Okay. Okay, and the systematic review, it can you can have the result of the systematic review generalized to all the population, because you're looking at different population, and you can actually look whether the relationship between the studies is same, in the same direction and same general magnitudes. And you can actually explain if you have different, the direction is different, then you can actually explain data inconsistency and conflicts in data. It increases, again, I cannot emphasize, it increases the statistical power and precision in estimation of the risk or effect size and accuracy. Okay. So when do you use this method? You can use this method if you want to propose future research, especially when you're doing a big grant. I always use this for the postgraduate dissertation or thesis, especially in the PhD. So PhD students usually use this method because it gives you a gap in the current research. And it's also very good when you have several primary studies with contrasting findings and very uncertain. You don't know whether this study says it's negative, the other study says it's positive. So you don't know which study is the best study. So you can actually do meta-analysis and you can actually have a the truth. Okay. And you can actually use systematic review for a variable of interventions, any health intervention, comparing drugs, compare surgical techniques, in clinical tests, comparing one kit to the other, in public health intervention, whether exercise is better than wellness, social intervention, any behavior intervention, any adverse effects of medication or surgical intervention, and economic evaluation. But economic evaluation, it's actually very difficult. You have to ask your health economist to help you with the with this kind of systematic review. So how do you tie in? Okay, I always say the systematic review is actually a very powerful tool. Okay, so because I'm an ophthalmologist, let's look at the potential problem, because this is a research question. Glaucoma is a leading irreversible blindness worldwide, and open angle accounts for 50% of glaucoma blindness. Treatment is effective in delaying progression, but you don't know what's the outcome because you have to study glaucoma for a long time. So what if we actually introduce screening? But in all the literature review, it says that if you have screening, there is no benefit. Okay, so there is insufficient evidence to recommend screening for open angle glaucoma. So that's why most of the developed country has not adapted screening of glaucoma. Okay, so there comes so as usual, a grant comes actually. In this grant is actually the health technology assessment program. They want to know whether screening is actually worthwhile in this country. Okay, so they have several questions at this stage. They have actually about 4 questions they wanted to ask. Okay, and they didn't actually go in and do a cross-sectional study or a cohort study. The fastest way to actually look at this grant is actually looking at systematic review. The first question, they wanted to know who is at risk, who you want to invite for screening, and how does these groups can be identified. They wanted to know what screening test is actually accurate. They wanted to know whether the impact of the screening and the screening is cost effective. So they actually did 4 systematic review to look at the incidence and prevalence of the OAG, the open angle glaucoma, and then to look second to look at the screening tests which are more accurate. Okay, and 2, they look at the impact of the screening, looking at the studies and look at the impact and screening, and then do an economic evaluation to look whether the screening of open angle glaucoma is effective. You can actually see just doing systematic reviews, you can actually answer a grant. Okay, and they have a clinical guideline, which is a health technology assessment that incorporate all this. So there's one big publication with 4 major. I think they actually generated more than 4 publications from this systematic reviews. Okay, and this what they actually had, the 4 questions that they actually found out that population screen is not cost effective, but they recommended that maybe randomized control trial with optimal design can see what is the benefits of the screening. But before initiating a trial, further research is actually, you have to actually do a further research to help in populating the economic model, because economic evaluation is all about populating the economic model and determine strategy for optimal screening or end case findings. Okay. So imagine from a grant with all the systematic review, they actually recommended a randomized control trial, and they have an emerging study, another emerging study of randomized control trial to look at how you develop the intervention and outcome components of the proposed randomized control trial for a national screening program. So that means from a systematic review, it has actually gone to a bigger question, and this has generated a lot of question. So that's why systematic reviews are very good in actually generating research question, and you can have good recommendation to actually do the next step. Okay, so you have evidence that is synthesis, and then you go back to primary research and you synthesis you evidence synthesis the primary research again. So this is an ongoing circle. Systematic review is just not static. It's actually a circle of life, if you say in that way. Okay, so I think probably you need to jump in the bandwagon of systematic review. It's easy to do, especially in this, and it is in this area of pandemic. Where do you want to get help? Okay, you can actually ask the Medical Research and Innovation Secretariat. Previously, we have the Evidence Synthesis team. Currently, I think Prof. Isanaina is actually doing a lot of systematic review. He's doing a lot of scoping reviews, but scoping reviews are only systematic reviews. But you have a full systematic reviews that go into meta-analysis. And you can actually also ask me if you want to actually do a systematic review. And other sources is actually the Cochrane collaboration, where they have a lot of CRGs, the Cochrane review groups, which includes research, health professionals, and consumers. And you have a lot of topic here. You can actually have from anesthesia, logi, cancer, eye and vision, orthopedic, gastroenterologists, and so on. And if you go into Cochrane collaboration, you can actually generate a review for Cochrane and also one review for you for a journal. So Cochrane impact factor is currently 9, so it is actually worthwhile going into the Cochrane collaboration. But apart from that, if you don't want to go into this into this collaboration, you want to do a quick scoping review, you can actually finish it in 3 months to 6 months. But if you do systematic reviews with meta-analysis, you can actually go on to 1 or 2 years. Okay, these are the recommended books for systematic reviews. Okay, you can have the systematic review of intervention in Cochrane, online. And this will help you in your systematic review. One thing I realized that I probably didn't actually go on very deeply into the methods of systematic review. Systematic review is quite a big topic. Probably you can actually ask me about the systematic review. How do you do about the search? It's actually done systematically and it's easy to do. So in conclusion, systematic reviews are actually easy to publish. This is the best evidence for clinical decision making, and this is a review that has been prepared using systematic approach to minimize bias and random errors. Thank you. Thank you very much.
Okay, thank you so much to Professor Jemimah for your wonderful presentation. So now I think we're going to look at the questions. So at the moment, there are 2 questions being asked here, but you can still keep the question coming on the chat box or Q&A sections. Right, so for the first question is, all right. So how about animal study, Prof? Is it common to be systematically reviewed? is the approach is the same for the clinical studies?
Okay, now there are, as I say, there are two types of systematic review, the scoping review, and the other one is the full systematic review with the meta-analysis. In scoping review, you can actually use in any methods, any study design. Because systematic review has systematic way of looking at the, you have a protocol, so you have a research question. And actually, example, because I'm involved in tissue engineering usually, so you want to know which scaffold is actually is best to use for your tissue. In my area will be the conjunctival tissue. So you can actually do a systematic review. You have a protocol. This protocol will say your research question is looking what is the best scaffold can be used for conjunctiva. From that, you can actually do a search, a systematic search, and from that you can actually synthesize or have a descriptive result of your systematic review. So this is just a scoping review, and you can actually use it for any type of study design, including animal studies. The method is the same, as I say. The method is the same. The only thing, you have to set your protocol. Okay. I hope that I answered the question, or is it very clear, or you want a follow-up question?
Thank you, Professor. We have another question. May I know a bit more about how the meta-analysis is done, and since the experimental design of each experiment is different, how are the statistical analysis in the meta-analysis?
Okay, I'm probably not the best person to actually discuss about the meta-analysis. I can give you a concept actually. Okay, when you do a meta-analysis, you actually, when you do it's actually systematic review first. When you do a systematic review, you probably have thousands of articles and studies. And from the thousands of studies, you can actually narrow down, filter down, and probably at the end of the day, you have only 10 studies. And then when you quality appraise them, especially randomized control trial, you can actually maybe have 5 or 6 studies, which is very good quality. And then 5 studies, you can actually put it in your meta-analysis. Okay, meta-analysis is, as I say, a statistical procedure, and we use in Cochrane reviews, they use RefMan to actually do your statistical analysis. Okay, so when we do the statistical analysis, you want to generate the forest plot to see which is it favors the intervention. Favors the intervention or disapprove the intervention. Okay, so you will have a lot of study, and you can actually check when you do your meta-analysis. You can actually check whether it's homogeneous or heterogeneous. Okay, if it's homogeneous, it's easy. Then your meta-analysis, you can actually do your meta-analysis. But if it's heterogeneous, then you have to do a sensitivity analysis to take out, you see whether if you do the study and you take out one study, whether it changes your study results. Okay, sensitivity analysis is part of the meta-analysis, and you can actually check whether taking out one study will make your study effects become different. And if it's different, then you can actually explain why, because of the heterogeneity. And that's why you take it out, okay, from the study. So that's how we actually detect homogeneity and heterogeneity. And from the forest plot, you can actually see the Z value at that stage. I didn't put it here, but follow up from there when you discuss about meta-analysis, there is also a graph. The forest plot will tell you about is it homogeneous or not homogeneous. Okay.
All right. So next one is the traditional literature review acceptable for publication, and how can we increase the chances of it getting published?
Okay. You're talking about traditional. Traditional review. I don't. What you call it? Fault you if you want to do literature review or narrative review, because narrative review are much more easier to do. You don't have to have a protocol, and you can actually do it. I can do it literature review in 1 week actually, and you can have it. But the trick of publishing a literature review, you must get the journal to approve your literature review. I've done that before. Usually, if you ask I'm actually interested. I've got one publication on home monitoring for home monitoring for glaucoma. That is a literature review. Actually, I asked the journal whether are you interested to have this topic being published. And once it is being approved, then I write my literature review in a week, and it's actually published in a Q2 journal actually. So you can have, but it has to be either invited or you have to ask the editor whether you like it or not. But saying that, you can still have narrative reviews as a quick cash for publication. And I think Singapore Medical Journal still accept narrative review, especially people who want or students who want publication before their graduation, because you need to write before you publish in PhD and masters. Okay.
Right, so the next one is good morning, Prof. If I'm looking at the explorations of factors, not an experiment or intervention, am I able to do a systematic review too?
Okay, as I say, systematic reviews are usually randomized control trials because they have a very easy way to actually look at the quality of the studies. But quality assessment is actually a checklist actually. Looking, because sometimes your question is factors, you want to look at factors affecting maybe your intervention. This kind of question, you can't do a randomized control trial, right? It's always effectiveness is randomized control trial, but factors affecting is usually observational studies, usually either cohort or cross-sectional or case control. So currently in our era currently, there are quality assessment for this kind of studies. I think I can't remember offhand because I usually do randomized control trial systematic reviews. So there are checklists for cross-sectional or cohort studies, and also case report studies. It's a bit difficult because there is a lot of bias when you're doing all this kind of observational studies, but the checklist gives you an idea whether the studies are good quality or moderate quality or bad quality. So to answer your question, yes, you can, but it's also difficult to to determine whether the qualities are good quality study or not. So it's a bit subjective when you're doing assessment of the observational studies. Okay, hope that answers your question. You can actually do, but with different tools compared to the randomized control trial. Okay.
Right, so next one, for the animal studies, how do we deal with the confounding variables in systematic review, i.e. difference in animal life stage, different routes of administration, different feeding trials, different duration, and etc.?
Okay. Well, when you do a systematic review, you actually you have to do a protocol actually. And the protocol have to address all the confounding factors actually. We have to cover all the confounding factors. When you, the systematic review does not look at the confounding factors, but you yourself as a researcher, you must actually know what are your confounding factors and try to address in your protocol. So from the protocol, it will state whether what animal are you going to use, what temperature you're going to put the animal, and whether it will affect your study. And how does all those confounder affect your study? So this is actually in the protocol. You have to think, what are the confounders? And actually look, you put it in the protocol. After you put it in protocol, then you do your systematic review. So the systematic review is just the method to actually look at all the studies, and then you you select all your studies by looking at the inclusion and exclusion criteria, and all the confounders is actually kept or you make aware of it, and then when you do the discussion, you will use all your confounders to discuss so that you can make recommendation. So that's it. I think I probably didn't, I didn't go into the methods very deeply, but when you do your methods, you have to do a proper protocol, and the protocol has to be like you're doing the usual animal study protocol. But bear in mind, these are studies you can have, and you can have when you try to select the studies, you can not have that information when you extract the studies. Okay. Oh, I just need to actually tell you also, when you do your systematic review protocol, you can actually register it in the SPPI, and you can have FF code for your systematic review, because it's actually, when you do a systematic review, it is a study by itself, and it's not just like the narrative review. So you have a protocol, and any deviation from the protocol has to be reported to the SPPI. It's the same as doing a study. Okay, hope that you answered that. I answered that question.
Right. So next one, is there any minimum number of studies to make a systematic review, in particular in newly discovered treatment?
Okay, one thing that you must realize when you do your systematic review, if you it is actually a very new technology, less than 5 years, then you don't have anything to study. So probably you can do the systematic review, but you'll probably get in 5 years, you probably get 1 or 2 studies. You still can have published it, but the important thing, your protocol can be emulated 5 years later to do the same systematic review. Okay. There are also instances that you have 10 years, you have been using the technique for 10 years, but the number of study probably is about 3 or 4. That is common in systematic review, because the systematic review filters, well, in my case, when I was doing my PhD, I was looking at systematic review with 10,000 articles. And then 10,000 articles actually filtered into 3,000 articles. And then from the 3,000 articles, I can actually get only about 20 studies. So you can look a lot. It's always 20%. At the end of the day, it's only 20% of the study is in the systematic review, and it doesn't matter. I think I'm quoting, I think Prof. Isa Naina, she'll be coughing. Prof. Isa Naina looked at a very rare question, and from the rare question, you can actually have 0. I think not Prof. Isa, my supervisor did a study looking at systematic review. One question where the laser peripheral iridotomy is actually useful in chronic angle closure glaucoma, and actually did systematic review. And at the end of the systematic review, there are 0 studies, and he still published it in a Q1 journal actually. The important thing is the question. The research question is important. If it's very applicable to the clinical, then your systematic review can be published. Okay.
Right, so next one, Salam Prof. I would like to ask a question in regards to meta-analysis. if I'm doing a systematic review of a prevalence in certain population, can we make a meta-analysis at the end of systematic review since prevalence is a descriptive study?
Okay. Interestingly, when you say that you think that incidence and prevalence, you can do a meta-analysis. But if you see the the usually quoted systematic review are on incidence and prevalence. Example, incidence of glaucoma in the world. So so this is a systematic review, and the author actually did a meta-analysis to look what is the incidence of glaucoma in the world, and he combines all the studies from different population and actually have one estimates. Well, we can't say it's the one incident, so it will have estimate with standard deviation. So you can do a meta-analysis for incidence and prevalence. Okay, one thing that I want to remind you, when you do a systematic review and you have the meta-analysis, you need to engage a statistician because the meta-analysis can be very, very difficult. Example, you have this technique, I can't remember, it's actually a complicated technique. And then sometimes you have that networking, because when you compare two intervention and then you have another intervention, which is compared to the other intervention, you have network meta-analysis. So you probably, this is above me, you have to have a proper statistician to be in your team for your meta-analysis, and you can't do it alone actually, because it becomes more complex. It will be more complex if you're comparing sensitivity and specificity. That will be a more complex meta-analysis. And if you have economic evaluation, then you have to have on board economic health economics and as a statistician. Okay. Not sure in UKM. I think Prof. Hasni was actually helping me with this systematic analysis for meta-analysis. But in IKU, in Institute Kesihatan Umum, we have a contact also that can actually do meta-analysis. So probably you can actually contact me if you want some help in doing the systematic analysis. Okay.
Okay, Salam Prof. How can I get checklist for a systematic review for observational studies?
I can't hear what.
How can I get checklist for systematic review for observational studies?
Okay, the easiest way is the Google. Ask the Google. So you actually type quality assessment for observational study. I actually have one. I think it's STROBE actually, STROBE. But I can't remember STROBE. I think STROBE is for observational study. That is widely used in observational study. But you can actually Google that. But offhand, currently, I suddenly have that thought block. But I think STROBE, STROBE, is actually used for quality assessment of observational study. Hope that answered the question. But you can actually type quality assessment for observational systematic review. They have actually.
Thank you, Prof. So this will be the last question. If there is zero study found during the searching and filtering, how do we write the result and discussion?
Okay, I can teach you how to write, but if you are the study expert, okay, I think from the start, when you do a systematic review, you have to have a good team. The team must consist of experts, okay, a statistician, and also a systematic reviewer, okay, and other expert, okay. When you do your systematic review, the protocol is actually looking at the co-founder. What is in the protocol is how you want to collect the data, because different studies will have differently, but you want to catch the common one. And if you have any discrepancy or you don't have, you know the next step in your discussion, there will be, okay, in our systematic review, I think this question is important, but this is not answered by the studies that we have looked at. So that is one recommendation. So recommendation in the systematic review is how the systematic review itself, how the process of systematic review. And the other one is actually synthesis of the evidence. Okay, if you have 0 studies, okay, that means this, and you think this is an important question, so you can recommend people to do a randomized control trial. And the randomized control trial is as what you think should be. And what you think should be is evidenced by the protocol of the systematic review. So this can be a very powerful statement because people will take because remember, systematic review generates gap, and the gap that you want to fill in is by research, as I look at as I illustrate to you. So that is answered by another study. So this is never ending. So even though it's 0 studies, but you're recommending people to do studies on the topic. And after 5 years, then you can do a systematic review, but no longer 0 study. You probably have more than 5 studies at that stage, 3 or 5 studies at that stage. So hope that answers your question.
All right, so thank you so much. I think that's all the questions that we have in the chat box. So with that, I think we come to the end of our first session. So I, on behalf of the committee members, would like to thank once again to Associate Professor Prof. Jemimah for being with us today and helping us to unpack a very important topics for today's, which is the systematic review. So thank you, Prof.
Thank you very much for inviting me.
Right, so it is through publication that research is disseminated to others in particular field. So coming up next, we're going to have Professor Abdul Halim, a nephrologist, who will share his thoughts on publishing your work upon graduations. But then due to his tight schedule, Prof will be not able to be with us today physically, but we'll still show you a pre-recorded session that we already have. So hopefully all participants will still get the benefits of his sharing. All right, so enjoy the videos. Unfortunately, we're not able to take any questions, so just enjoy the video. If you have any questions, so maybe you can ask later during the forum session. Okay, thank you.
Assalamualaikum warahmatullahi wabarakatuh and good morning everybody. Let me share my slide first. First of all, I would like to say thank you very much to the organizing committee for inviting me to speak on publishing your work upon graduation. I think this is a very good topic. I would like to say congratulations to the organizing committee because I think it is difficult to do any conference during COVID-19 pandemic. I think with this is the outline of my talk. One is why must we publish when we, as a doctor, you know, all of you going to be a specialist, but what is the importance of us to publish paper? I will speak on the general approach. How do we want to get our work to be published? And then I will speak a bit on the way for us to publish original articles and the way for us to publish case reports. And finally, I will summarize my talk. I think, of course, there are many other form of publication that I do not gonna speak on, but I guess I'm gonna give you a general view on the attitude and the right approach for us to get our work published. And before that, let us look the reason why we do medicine, why you all do such specialty. You know, all of us want to be a doctor, want to be a specialist. Of course, there are many reasons, you know, some of them because of parents' pressure, and some of us will have friends' pressure. And many of us actually wanted to become doctor because we wanted to become doctor, and we want to become specialists because we want to become specialists. So this is important. Whatever the reason, you know, for me, once you decided that you're gonna continue and become a doctor, you should do whatever you can do, you know, to be a good doctor. And if you decide to become a specialist, you have to do whatever you can do to become a good specialist. And I will touch later about the importance of a publication, you know, when you become a specialist, you know, why is publication important, and in our daily clinical work, and then how to get things published. Of course, I'm not the expert. I'm quite sure there are many others with many other ideas, you know, but at least I can try to give a general idea on how to get our work published. And when we look at the reason for people to become doctors, you know, there are good reasons and there are not so good reasons. Again, here when we look at as a medical student, some are passionate about medical science and they wanted to become doctor for the good reasons, and you all wanted to become specialists for a good reason. You know, you have complex problem solving, complex thinking, and you want to communicate with others. And there's a good reason. And you enjoy talking to patients, you enjoy doing work, you know, either clinical or preclinical. That there is a good reason for us to do medicine, even to specialize in areas that you like. But there are also some not very good reasons, like this is pressure from your peers, you know, pressure from your parents, even pressure from your siblings or from your spouse, you know. And some just wanted to become a specialist because a lot of actually become specialists. So they thought the way forward is just to become a specialist. So whatever the reason for me, once you decided to become specialist, you decided to become a doctor, we must get used to it, and we have to do the best, you know, to be the best in whatever you decided to become. Either you just want to be a medical officer, or many of you now actually doing a postgraduate, so you want to become a specialist. And later in your life, you realize that specialist may be not enough, then you want to become such specialty in a certain area in your specialty. So this is a quote from a movie, a book actually, Life of Pi. You can get used to everything, and is that what all survivor says, you know? So you can get used to it, and you have to be the best in what you're doing. So that is the right attitude. A right attitude, become a doctor. A right attitude, become a specialist. Right attitude to do such specialty, and with that, I think you all can go far. So this is a prospect of medical degree, you know, and of course this is true for postgraduate also, you know. Many of you want to become specialists. Of course, in undergraduate, they want to become doctors, you know, but now you're doing postgraduate. The one that doing postgraduate, you want to become a specialist. So, but again, there are other things, you know, that you have to look at. You can become teacher like me. You can become a lecturer. I think it's always nice, you know, when you become teacher, when you become a lecturer, you always need to update yourself. And you will learn new things when you are teaching. And I learn new things when I'm preparing any talk to give, you know, and you will read. That is when you read for me, when you are giving lecture, and also when you're doing research. That is when actually you will go into it and really read about the subject. And that is important, because with that, it actually will improve your knowledge, and that will benefit your patient. So that is a prospect that you have to think about, that many of you will become a specialist, and you become teacher. You will teach your medical officer, you will teach your house officer, you will teach the nurses, the paramedic. Then with teaching, that is important for you to upgrade and your knowledge. So that's important. Some of us maybe will go into pharmaceutical company, be CEO in the pharmaceutical company. So that is important too. You always have to open your mind, not necessarily you do a clinical work, but maybe you will be a CEO in some pharmaceutical company. And some of you will be administrator, with your clinical knowledge, you still can be an administrator. And like myself, now I do some admin work. And not to forget that some of you will be researcher or scientists, So the one that work in the universities, even the one working in the private, working in Ministry of Health, you can be a researcher or scientist, and that is good. That is good, because later we show why do we need to do research. When we are actually a specialist or we are a doctor. And there are the prospect too, just always open your mind, and see, what you like to do, and always follow your heart and do what you can do. And you can be few of them, you don't have to choose. Either you become a doctor, you become a teacher, or you become a CEO, you become admin. Some of us can actually be few of that together. You can be doctor, you can be teacher, you can be admin, you can be researcher at the same time. I remember somebody advised me last time to say, Halim, you cannot be good in everything. You cannot be good in clinical, and you cannot be good in clinical, and you cannot be good in research. You cannot be good in as a teacher, but you have to challenge yourself. You have to challenge yourself and tell yourself that you can be good in everything at one go. Of course, it's a bit difficult, but maybe everybody must push yourself. You never try to underestimate you. You can do it if you push yourself. So remember that this is the prospect that you have. Of course, many of you now think of passing the exam and becoming a specialist, become a doctor. But in future, you have to think that maybe you're going to be a teacher, you're going to be a researcher, and you're going to take some admin posts. Why do we do research, and why do we publish in medical school or when we are doing our postgraduate training? One is important to expose and increase understanding of clinical medicine. There are so many areas in clinical medicine that we are still not sure. There are still new way of us treating patients. I always thought that last time there's certain way for us to treat a patient with diabetic kidney disease, but recently there are many other new drugs that we can treat this patient with diabetic kidney disease. So, and this is true for many other diseases too. So we cannot stop and only think that that's all that we can do for the patient, because there will be new drugs, there will be new procedure that will be benefit to the patient. And now we are having COVID-19 pandemic, a new disease, a new virus that we do not know before. Then we cannot treat the patient without any clinical research, because if not, we do not know what is working and what is not working. So I think it's important to know this. So always when you treat a patient, you always have to think about the knowledge gap and try to ask questions. I think asking question is important. By asking question, then only you know that there is a knowledge gap in treating patients. So in that sense, you will want to do some research to look at the way we treat patients. And it is true, there are many studies done overseas, but there are some diseases that very specific and peculiar in Asian population, that this disease is not very frequently happen in Caucasian patient, so like systemic lupus erythematosus, lupus nephritis, IgA nephropathy. We can see many in Asian patient, and the way we treat also it is going to be a bit different, And of course, genetic will play a role also in this area. So I think not only important for us to do a study to look for new procedure and new drugs, but I guess it's also important for us to do a study to look at the impact and the effect of this procedure of this drug in our population. And it's important also when you become an administrator or you become a consultant, for us to actually convince government to change policy, you need local data. So that is why we need to do research. We need to do a study in medical. Study and research also will facilitate critical thinking and critical appraisal. That is very important because it will actually sharpen your mind and whenever you see patient, you have few differential diagnoses, and because maybe this patient do not have one single diagnosis, and when you have critical thinking, that will be beneficial to your patient. And for undergraduate, if you do a research, it will improve the prospect of successful application for postgraduate training. For a postgraduate student, if you do research, that will increase the prospect of you getting a permanent post. It will increase the prospect of you getting a post in the university. It will increase the prospect of you getting grant, and of course, it will actually improve your knowledge and experience. So in future, you can actually publish in high impact journal. It is important to know that publication and also research is not only important in university, because there are many research and done in Ministry of Health. So if you are even in Ministry of Health, you have to do research, and with research you can progress and can go far. So research is good to improve your CV when people look at you, when you have a lot of research or grant and you are into research, you have higher chance of getting a higher post in either Ministry of Health or university. Research also will develop teamwork skill. It's important to do a good research study if you only do it in one unit or one department. So, and even if you do it in one unit or one department unit, you actually need a lot of help from a research assistant, from your medical officer, from your nurses to get the data, to collect the data. So, it will actually improve your skill of controlling or giving orders to and discuss with your team. And not even that, as I mentioned just now, research is important because it actually will improve your skill for you to talk to other departments, because it's important. It's a bit difficult to do research only in your department. So you will have friends in other departments, even non-medical faculty. I have research that I do with engineering faculty. So it will actually improve, and you will look at medical differently and in a broader perspective. So that is good. Research also will increase exposure to the best clinical mind, so you will expose yourself to many other researchers that will have ways of treating patients, and then you will see how other people do treat patients. So in multi-center study, you will have friends in other countries, in the Philippines, in Thailand, in Australia, and you will know how they treat patients. So that will benefit your patients. So that is why we have to do research in medical field. And of course, now it is for you actually it's important because it's a requirement to graduate. So you have to do research to graduate. But I don't think that is important. Of course, it's important because you want to pass the exam, but the benefit of doing research is more than trying to get a certificate. What are the type of work that can be published? You know, there are many. If you look at this, I put down there case report, guidelines. You know, guideline is really important. You know, and it's not an easy work to do guidelines. You really have to look at many papers and look at the local scenario, whether you can actually use the guideline locally. You know, of course, everybody can look at a guideline, international guideline, but the thing is whether the guideline is can be used locally is something important. So it's important for you to look at and maybe do a guideline for Malaysia, in whatever disease or whatever subspecialty that you're doing. You have original articles, so that there is a normal one. We do original article, you know, to look at a study in some disease, you know, on some procedure. You can do systemic review. When you have many case report, you can write down a case series, or you can write a review article, you know, with the help from your supervisors. So these are some of the work that you can publish. You can write report. I've seen students that publish a lot. You know, they publish a lot. They publish in terms of case report. They publish their dissertation. They publish some guideline. Come out a simple book to the houseman. So you can do that, and I think that is good because, again, as I mentioned to you just now, when we actually publish and we try to write down protocol, that is when we will read. You know, you will read about the case, and we will know a lot of increase our knowledge in that particular area, and with that, it will help actually the way we treat patients. Is there any opportunity to publish? SSM is a special model for for medical students. There are a lot of opportunity. Yes, there are many opportunity. SSM is one of that. When we do round, of course, in pandemic, it's difficult to do round. But normally, when we have a grand round with your consultant, you know, you will see some nice cases that your consultant will ask you to write. So when the consultant asks you to write, please take the opportunity to read around the case and write, and try to get it published. Because of then you will see the beauty of looking at case and try to get published. When you want to get this case to be published, it is this is when you will read about the case. So again, it will be beneficial to your patient. You get the opportunity when you present a case in the clinic. That's when sometimes your friend or your consultant will ask you to write and to read about the case. So I think it's important. That's when you will have some idea to write and to read around the case. Of course, dissertation, your thesis, try to get it published. So it's important how to get it published, because if you you plan your thesis, dissertation early, you can get it published. The problem is that when you do it last minute, you don't have the time to get it published, because to get it published, you need time to get it published. I will speak a bit more, later. You need time to get it published, because when you send to a journal, they will take time to ask the reviewer to review your paper. The reviewer will come back and maybe there's some amendment. So it will take at least about 6 months. So you have to finish your study early and try to send it to the journal and get it published. You cannot do that if you do everything last minute. You can do that if you do your proposal early and finish your research early, and then get it, send it to the journal and try to get it published. What do you need? these two important things, I think, is one is your own interest. You must have this drive to get your work published. You have to, the most difficult one is your first paper. That is the most difficult one, I try, trust me, the most difficult one is to try to get your first paper to be published. That is difficult. And you need this drive. You need your own initiative, to get it published. So sometimes it will take 6 months, the reviewer will write some nasty thing to you, and you feel down, you feel bad, look at their comment, but you have to think positively, you have to think critically, and try to improve the manuscript to increase the chance of that getting published. And another important is a good supervisor. This is important, a good supervisor, a good supervisor, the supervisor that help you in not at the end, but when you're preparing your proposal, supervisor that actually look at you and help you in writing the proposal, helping you trying to get the correct connection, so it's important to find a good supervisors. And good supervisor also the one that actually will try to encourage you to publish your work. But I understand that many of you do not like your supervisor to keep asking where is your proposal, why you do not send, but they are doing this because they want your work to be published. It's important to get your work to be published. It's not only, you think this is only important for your supervisors to get it published, but supervisor want your work to be published because it will be beneficial to you. As I said, the most difficult one is try to get your first paper published. Once you get your first paper published, I think things going to be easy, for you to publish other things because you know the process of how to get your paper to be published. This is important, I always, when people talk to me, and talking about your first paper, I think it's good to aim high, but you have to be realistic. I always believe that get it published first. Many people will now talk to you, I want a Q1 journal, I want a Q2 journal. It is important, but you have to remember that you have to learn how to crawl before you walk. So it's okay if your first paper is not ISI, it's not Q1 or Q2, but what is important is the experience that you get in the process of trying to publish your work. I see it is funny, to expect people to publish Q1 in Q1 journal when this is their first publication. So be realistic. This is important because later when you try to find a journal, you have to be realistic to find a journal that can accept your publication. So it's important to publish first. Some people are so obsessed of trying to get Q1 or Q2 journal, ISI journal, until they did not publish their work at all. So that is bad. I saw a lot of people do a lot of study, collecting a lot of data, but fail to publish it because they are hoping for Q1 or Q2 journal. That is wasted. This is like you have you have a tree, you take care of the tree, but you don't have fruit from the tree, so that is bad. So I think what is important, if you have data, try to get it published. That is important. And maybe for your first paper or second paper, be realistic. Don't worry too much about ISI, about the impact factor or Q1, Q2 journal. Get it published because remember that you have to learn how to crawl before you walk. And you have to enjoy the moment. You have to enjoy doing it. The problem because when there are a lot of pressure of trying to publish in good journals, sometimes you lost, you do not enjoy doing it anymore. When you stop doing that, you stop enjoying doing something, you don't want to do it anymore. So it's going to be your first and going to be last paper, you know. So I think enjoy the moment in terms of collecting data, in terms of analyzing data, and with that, then only I'm quite sure if you enjoy the moment, you will want to publish more, you know, because we do not want to publish only one paper in Q1, then stop publishing. So remember that, be realistic and enjoy the moment. So how to get it published as a graduate student and postgraduate student, you know, again, you have to plan, you know, you have to plan, and you have to decide fast and begin working toward this goal early. You know, you have to decide fast. You know, many people do not want to think and approach any supervisors because they thought it's still early, they don't want to do that. But remember, as I mentioned just now, the process of getting published or finishing the research, it is long. Even you can actually finish the research now to get the work published, maybe it will take 1 year. So to get it published during your postgraduate training, you have to start early, you know. You have to think about, you have to read and find out what you are interested in, you know. When you're doing round, when there's a discussion in the clinic, try to understand what is the knowledge gap, approach your supervisor, approach your lecturer and ask whether there is worth of doing this study. And writing a proposal will take a long time because we want to make sure the study is good. So I'll talk a bit on a proposal writing later. So you have to start early. This is important because you know that the process will take long, you know. You should consider writing book reviews, submitting papers to conferences. This is important also, you know, submitting papers to conferences, and some conferences will publish your abstract or proceeding in a journal, and that will be good for your CV. So submitting papers to conferences is important, and it can be a study, it can be a case report, but whenever you go for a conference, try to submit a paper because it can be published in a journal, so that is good, and that will make you feel good and you want to write some more. It will give you, you have to work with the professor on the research project or work with your lecturers in your research project. Again, I want to emphasize that it is important to get the right supervisors, you know, the one that do not pressure you too much, and very realistic, and try to get your paper published, you know, so it is important. And I have a lot of, even I have a house officer that call authoring my articles, you know, she's very interested, and she became my research assistant, and she wrote a lot of papers with me, you know, while she's waiting for her housemanship. She wrote a lot of papers with me when she became she was my research assistant. So that is good. And preparing the thesis or dissertation project geared toward publication. As I mentioned to you just now, then whenever you write a thesis or dissertation, it's not only for to get a certificate or to complete your postgraduate training, but you have to gear for publication. And if you gear for publication, you have to be realistic to study early, because if you study late, you cannot. So this is the most important thing. You have to start early. You have to start early because it takes time. It will take time. You also should be familiar with publication process. I will touch a bit on the publication process, but maybe you can ask around how the publication process, you know, and then you understand that it will take time. And again, I cannot emphasize more that you have to find the right mentor. The right mentor is important because it will actually help you in finishing your study, and also it help you in try to get the right conclusion from your study, and also get your work published. So that is a general ideas on how to get your work published, and cannot emphasize more that it should come from you. You must have own initiative to finish your project, to finish your study. And how to do that? By starting early, and you have to plan to get it published before you complete your training. So that's important. You need your own initiative, how to get it published, approach your supervisors. And number 2 is that approach your supervisor and try to get good supervisors. So because a good supervisor can help you get your study done and complete your research, and also get it published. So number 1, you have to have your own initiative, start early, 2, get a good mentor, get a good supervisors, and then you will get your work published. Let us look at original article. If you want to do a research, you want to do a research and a research project, look at original article and how to go about it. So publication phase here actually comprises of 3. You have the proposal phase, study phase, and writing and publication phase. Of course, the writing phase, some of you will present your thesis, and I hope you won't stop there. And after you present your thesis, you will go and try to get it published. So proposal phase is important. It is important because if you have a bad proposal, you will have difficulty in completing the study, and you will need to change your proposal, and it will take time. So you have to spend time to find out the topic. Discuss with your supervisors, find your supervisors, discuss with your supervisors how to write a good proposal. You must have a research question, and research question should be solid. And as I said, it can be a new pilot trial that no one did before, or you can do a study that you think, although it's been proven in other countries, but maybe it is not true in Malaysia. So you want to find out whether this procedure is beneficial for Malaysians. So it is okay. And as I said, that if you want to change policy, you need to have a local data. So many times, we need a local data for us to change the policy. So get a research question. A research question you have to discuss with your supervisors. And you have to read a lot. You have to read to see, whether it's worth to do this study or not. The proposal shouldn't be long, shouldn't be long. It should be short and easy to understand. And you have to emphasize on, in the proposal, you have to tackle what is the objective of the study. And what's the research question, and what is the objective of the study, and what is your hypothesis, and how do you want to prove this study? How do you want to prove whether this question, this procedure of this drug, is working for the patient? So this is important. But the proposal should be short and easy. People should understand easily, You have to pay attention at a statistic, statistics is important. You have to calculate the sample size. And again, sample size is important. Let's say you get sample size for 100. So you know how long do you need to take to complete this trial. So it's important. Again, if the sample size is 100, no point of you taking 200 because it's ethically wrong. So of course you take another maybe 10% more because you worry of patient dropout. So maybe it's going to be 120 patients. So at least it will give you ideas. And again, at that point of time, you have to think of what the possible statistical analysis that you should do to prove this. So statistics is important and should be in the proposal. You have to mention in the proposal what are the statistical analysis that you want to do to prove this, whether this treatment or this procedure is beneficial. And you also have to pay attention to ethics, ethical issue. Remember that first of all, we shouldn't do any harm to the patient. Or we have to be justice to the patient, just to the patient. We have to make sure it's just to the patient, and And of course, you have to be fair, to the patient. So, and again, a patient autonomy is important, means that we cannot force the patient to be in the trial. So I always mention to the patients, either you are in or you are out from this trial, I would treat you exactly the same. I in the future, I will still see you, and whether you agree or you do not agree to be in trial. So it is up to them. And of course, you tell them the benefit of being in the study, that they can actually improve the medical knowledge in that certain disease. We need a CPG, everybody, clinical practice guideline, you need a CPG to make sure you must have the certificate. Because when you have the certificate, that's good. At least your supervisor must have the certificate. So CPG is important. And with the proposal, you have to present to the ethic review board. Not Proshari is the head of the ethic review board. And when you present to them, I think it's important for you just to do not write too much medical terms. Let's say the study in ophthalm. I won't know any specific about ophthalmology. But when you present to the ethic committee, you have to emphasize the ethic problems, means that ethical issue means that this study would not is ethically correct, actually the patient, we won't do any harm if the patient agreed to be in the study. So that is the ethic committee, they want to see whether this study is ethical or not. So that is the purpose. So don't worry too much about the science behind that, but you have to emphasize on whether the study is ethical or not ethical to be done in our patient. So remember, and don't be defensive. Sometimes I see people, be very defensive when they are present in the ethic committee, because ethic committee, they just want to make sure that our study is not, it won't be harmful to the patient. And after that, you have to register the study. Of course, with when you get the approval, you will have some registration number, and you can register even nationally or even internationally, because many publications now, many journals need that registration number of the study to get it published. So it's important to have that. So at least the journal know that your proposal, your study have been through all the necessary ethical review board, and it's passed by the university or by Ministry of Health. So proposal phase is important, and make sure your proposal is short and easy to understand. So and again, when you present to the ethics committee, make sure we emphasize on whether it's ethical or not ethical to do this study in a patient. Study phase is important. Recruitment have to start early. We have to start early. We have an inclusion and exclusion criteria. You have to get the consent, and getting the proper consent means that you don't force the patient. I know that you all will not force the patient, but you have to explain the patient to the patient regarding the benefit of this procedure or this drug. And again, if this is placebo control, there is a placebo group, you have to explain there is a possibility of the patient getting placebo. So you have to explain that not everybody will get this procedure or this drugs. Some of you will get the placebo, but you will still monitor this patient. And you have to look at the difficulty of the patient of coming and doing extra tests. Remember that you cannot do the study, until the patient sign the consent. So consent is really important. You have to look at the checklist, your own checklist of inclusion and also exclusion criteria. But what is important that you have to give patient time, and sometimes you give a patient time to read the patient information sheet. You can let the patient go back and read and come back when the next appointment to tell you whether they agree or not. Of course, you can take the patient phone number and you can call. So you have to give the patient ample time to read the patient information sheet. Is important. When you recruit, you can start doing whatever procedure and or giving give whatever medication or to the patients, and of course there will be follow up time. You know that you must see the patient. Possible you have to see the patient and to show that to the patient that you are serious in the study. You know, you are the one that they should come back if they have any problem. It's important to at that point of time also to document any side effect from the procedure or side effect from the medication. So it is important, you know, to do that. And data entry, you have to enter the data. You know, I like to enter data straight away to SPSS. So some of you were put in Excel, you know. So, but you have to enter. You know, you have to enter the data. You don't only write down in the paper, you know. But if you possibly just write down straight away in SPSS or in the Excel, you know, so the data will be there all the time, and you can see whether the data is complete or not complete. If not complete, you have to go back. So the study phase will take time. The first one is get the consent, and remember to get the consent. Then you have to give the patient time for them to think. When they are already in the study, if possible, make sure that you will see the patient and follow this patient up. And it's important also sometimes, even after the study, you still follow this patient up, so they know that you are serious. There are many times that because if you're involved in a study, that patient can be in another study that you do. You know, when they trust you, they will actually want to be in the next study. So this is the study phase. And finally, the writing and publication phase. Of course, writing a manuscript is difficult, and of course, you will help when you have a good proposal. Of course, the proposal I said should be short and straightforward. In manuscript, you have to write a bit longer. You have to explain. And of course, if this is for your dissertation, you know, initially you will gear up in the dissertation. But the thing is, if let's say you finish your study early, you can start finding a journal to get your work published. And finding a journal is important. As I said just now, you know, you have to learn how to crawl before you learn how to walk. So be realistic. So don't, if you don't think your paper can get, your study can get published in Q1 journal, I don't think you should try the Q1 journal first. Get it published first. You know, that is the feeling is really good if you get your work published. You know, I tell you. So try to get your work published, and of course, finding a journal, you need your supervisor help. You really need your supervisor help here when you find a journal, and because and the supervisor normally can advise you which journal that you should emphasize and which journal that you should go. You know. And finding a journal also, sometimes nowadays you have to decide whether this is open access or this with copyright. You know, there are many journals with open access, and there is an article processing fees. You know, have to think about fees. If you get a grant, that you have you can have some money to pay the fees, so you can actually try to get it published in article with open access. You know, so people can access to your journal. Then you submit, and submitting journal also is important, you know, to follow the step. And some of them will need a bit more. When you submit, they will ask a bit more. They need extra letters and things like that. Make sure that you send, or they need extra tables, you know, that you send. And if you do it early, you will have time for the journal to come back to you, because once the journal receive your submission, they will have to send to the reviewer, and the reviewer will take some time to read your journal, and they come back. And normally the first time around, the reviewer can be something. The comment can be a bit strong, but you have to think positively and take whatever comment in a positive way, and try to improve the manuscript based on the comment, and answer the comment one by one. And normally you will need your supervisors, discuss with your supervisors how to answer the comments, or sometimes the journals answer back to say straight away reject your paper, so you have to find another journal. Again, with that, you have to discuss with your supervisors which journal that you should try later. So it will take time, this process will take 4 months to 6 months. So that's why, again, it's important for you to start early in identifying the questions, the research question, and doing a proposal, and present it to the ethics committee, and doing the trial study and sending it to the journal. So it will take time. I mentioned to you that the article processing fee, so some journal will have some article processing fee. So you can discuss with your supervisors to see how the best way to go about it, And of course, at that point of time, so when you send, you have to discuss with your supervisor who should be the co-authors, who should be, and what is the sequence of the authors should be there, who's the first author, who's the corresponding authors, and who's going to be the second, third, and then final authors, So, and normally the corresponding author is the one that submit the paper. So if you submit the paper, you should be the corresponding author. So, and finally, if everything goes well, your work will be published and you will feel good. Trust me, you will feel good with that. So again, you have to start early. Then only you can get it published before you present your thesis or dissertation. So start early is the word, is a key word. So that is for original article, you should do that. And case report is another thing that I think you can write a lot of case report. Again, some specialty will ask you to write a case report, in a certain subspecialty. So that case report can get published, and should try to get it published, because it's wasted, because you already written the case report for your for the subspecialty, so you should try to get it published. So again, this is a publication phase of case report. Discuss the case with your supervisors, and remember to take photos. Normally, photos will be very helpful for the case report, and choose the right journal, and it's important to choose the right journal. Not all journals accept case report, but find the journal with case report, and writing the manuscript, submission, and again, after submission, you maybe will have to do some amendments to the submission. And of course, this will take time also, but case report normally will not take too long. So it will take about 4 months, to get it. And again, article processing fees is sometimes you have to pay to get your work published. And finally, get it published is good. And there are so many case reports that you need to write, and I think wasted if you cannot get it published. And I'm quite sure with the help of your supervisor, you can get it published. Again, when you get it published, it is you will feel very good, and you will keep on trying to get your work published. So in summary, ladies and gentlemen, it is possible to publish. It is possible. It's very much possible. It's important to publish. As I say, the benefit of publication is not only to get to your postgraduate training, certificate, but it's important in future, because when you have publication, people will actually give you higher posts, and they will, and you actually will open the door to many other possible opportunity. You can be a lecturer, you can be a researcher, and at the same time, you be a clinician. Remember that you have to start early. It's important start early because to get it published, you need time. You need to get a good supervisors, find a good supervisors. Again, start it slow, when this is your first publication, don't pressure yourself. You shouldn't be trying to publish in Q1 or Q2 journal. Get it, start slow first, and you have to be persistent. You have to always try persistent. Whenever you get the comments from the reviewer, take it positively. Try to improve your manuscript and resend the manuscript. And and maybe they will accept it and you get your work published. I think that's all. Thank you very much. I hope that this helped you a bit. Of course, there's a lot of area that I cannot touch, But again, as a summary, you have to be persistent. You have to start early. You need your own initiative and find a correct supervisor that can guide you, can mentor you to get your work published. And once you get your work published, you will feel really good. Thank you very much. And I think
All right, thank you very much for all your kind attention. So hopefully I've gained some insights on why conducting research and publishing your work one of paramount importance, not only for your graduation, but also for various reasons, as beautifully put or explained by Prof. Halim just now. I do notice that some questions coming in the chat box, but this is a recording session. So what you can do is basically you can just forward your questions or any inquiries to the emails that have been posted by the committee members. So with that, I think we have come to an end of our second session. So we're going to take 20 minutes break. So the session will be resumed at 10:50 a.m. Right? So till then, have a nice rest. Thank you. Hello, hi. Assalamualaikum warahmatullahi wabarakatuh and good morning. Welcome back to our third talk for this morning. All right, so needless to say, as a postgraduate student, you will definitely need to make a presentation quite regularly at different levels. So be it with your supervisors, department, faculty, or even at national and international conferences. But how do we make an effective presentation? So to help us to unpack the topic today, we're going to have Professor Raja Effendi Raja Ali with us today. So Professor Dr. Raja Effendi Raja Ali graduated with honor degree in medicine and completed the Master of Medical Science in Gastroenterology and higher diploma in clinical teaching from National University of Ireland. He subsequently underwent higher training in specialty of gastroenterology and hepatology and was awarded the Certificate of Completion of Specialist Training by Royal College of Physicians of Ireland. He was also conferred a Doctorate of Medicine degree from NUI for his research on inflammatory bowel disease and colorectal cancer. He is a Fellow of Royal College of Physicians of Edinburgh and American Gastroenterological Association. Prof was awarded Fundamental, Transdisciplinary and Industrial Research Grant to research on patients with IBD, CRC, irritable bowel syndromes, and gut microbiomes. He has supervised and co-supervised 34 master and 9 PhD students, as well as 10 clinical fellows in gastroenterology and endoscopy. He served as president to the Malaysian Society of Gastroenterology and Hepatology, council member for Asia Pacific Associations of Gastroenterology, educational committee members for the Asian Organization for Crohn and Colitis, and a clinical research committee members for the World Gastroenterology Organization. He was selected by the World Endoscopy Organization to attend Emerging Stars program for year 2018-2019, and part of that taught modules including how to face the media and deliver effective presentation. He has also completed the Oxford Executive Leadership Program and currently serves as a professor of medicine, consultant gastroenterologist, and Dean of Faculty of Medicine, the National University of Malaysia. So without further ado, over to you, Prof. Dr. Raja Effendi.
Assalamualaikum warahmatullahi wabarakatuh. Cross-check, Dr. Hafiz, can you hear me?
Yes, Prof. Loud and clear.
Okay, thank you. Thank you. Assalamualaikum, salam sejahtera. Very good morning, and thank you for the kind introduction. And my task for the next 40 minutes or so to discuss about the effective presentation skills. Thank you for the kind invitation, Dr. Muhammad Haikal, the chairperson for the 23rd Medical Research Week and Organizing Committee, and Prof. Tan Giok Chin, the Deputy Dean for Research, for holding this meeting even in the current pandemic situation. Now, so the outline of presentation, I'm going to go to the basic principle, avoiding common mistake in presentation, how to wow in delivering presentation, what are the tips and tricks. Nowadays, tips for virtual presentation also in this COVID-19 pandemic, and take-home message. Now, if you look at the survey in the Forbes magazine or any magazine, economies or many other business leader magazine, 70% says that presentation skills are critical for career success. And this also includes engineering, medicine, architecture, and many other professional courses. So it's very, very important that we have to have a sound presentation skills to colleagues and friends, and also to whatever that you present to. So I think those who are in academia, 3 pillars of academia, you can see teaching, research, services are basically, we are multitasking, but very important to focus what we're doing rather than just neither here nor there. If you like to study disease A, you make sure that your research, teaching, and services are top-notch for that disease A. And of course, you also take other diseases as part of your usual menus. But you must have a main course, you must have your own niche, so that if someone mentions your name, you are known to actually expert in this particular disease. So you have to have a substance, you have to have the high impact publication, you have to have many evidence base to showcase your expertise. Now, what I can see, the types of postgraduate students for the last many years here and abroad, there are 3 types. Number 1, those who really want to happen, who really want to make their studies, their career to happen. And the other one is he or she wait to happen for her or his career progression. And the other species is wonder what happened. So, you know, just follow the trend. There's no dedicated plan, PAP, action plan for the next 5 or 10 years of his or her life. So I think everyone should have done that, because make your determination, make your strategy in day-to-day activity more meaningful or more dedication, rather than just a routine things and you don't even know where you're going to be in 5, 10 years or even more. So what is presentation actually? It's a process that presenting anything that you want of a topic and to the audience. Yeah. Of course, sometimes a very small audience, sometimes a bigger audience, depending what you are asked to present, whatever the topic is. Of course, you utilize some visual AV8, so and so. I think Prof. Azmi is very expert in this in the era, so we need really more skills. And the name of PowerPoint is just a point that you write on your slide, not a sentence, like however or this. It's just a point for you to catch and you elaborate spontaneously with your skills. I have seen many people who presented either junior or middle rank or senior, they read with the papers. They bring 50 pages, they read slide 1, slide 2. That is really not interesting at all. It's just boring and it's not entertaining and people just shut down. So therefore, as basic steps in making effective presentation. Number 1, you must have a strategy. You really have to formulate a strategy for specific audience. If you are giving the talk to the GP, your language has, or your wavelength, or your language you want to use must be at the general practitioner level. If you are going to talk to your GI or whatever fellows, your language has to be make them. If you're going to talk to multi-audience, there are multi-specialties about science, about cells, so you really have to understand how to regurgitate or mention to them. Otherwise, you don't know the audience, and you just keep talking yourself, you end up with a short sendiri syndrome, which is not good. Number 2 is structures. You really have to develop algorithm or flowing structures from the introduction or what content that you want to say, in typical abstract background, methods, result, and conclusion, so and so. And the style of presentation, how you present is as important as you present, meaning that you have to embed it like video, infographic, not too congested, not too busy, you shut down other people, and not too deep in your specialty, because if your audience are general practitioner or general lecturers, they want to know, you have to have a tonation, you have to have a language that understood by all of the audience. And then you have to have a confidence in responding to questions. Sometimes what we call a question is unexpected and beyond your capability. So you have to be honest. You just say that I am not familiar with that. So don't try to be put a rubbish and add this and that. People will laugh at you. So the knowledge, as you go deeper in particular disease, the more that we don't know. So in the opening, the 3 ways how to open your presentation. Number 1, with a question that really matters to the audience is you give a presentation to general practitioner of type 2 diabetes. So maybe you throw the question first, how many diabetic patients in Malaysia? You also can give a fact that is shocking to them. Or you also can start with interesting story that you met a patient, for example, yesterday I met a patient, 21 years old with dyspepsia, GERD. I want to do endoscopy, but she has amenorrhea, no period for 3 months, and refer to gynae, and bang, there's a baby there in the uterus. So you have to start either a questions, a shocking fact, or interesting story. Now, if I give, for example, to the audience, what are the 3 most common cancer for men and women in Malaysia? So I will highlight, because this is my specialties. So colon cancer is the first common cancer for men, and the second for women. So not too many slide, not too many wordings on the slide, because it's very difficult to absorb. And people maybe can pay attention for the first 20-25 minutes or so. And also give facts to the audience. First cancer for men, second cancer for women. The risk of getting colon cancer is about 1 in 33. You can highlight that. And strikingly, 90% of cancer occur for those who are 50 years or plus. So this is just introduction to get the adrenaline of the audience up, rather than, just use monotonous speech. There are first cancer for men, second for women. There is, you have to have variation in your tonation of your voice. Give the facts that shocks. 91% cancer cases diagnosed at advanced stage. There is no formal screening to date in Malaysia. So people thought there are screening here and there, but there is no formal. So if you get a reference, put on the bottom. If you don't have, but this, but you have to be very clear in this. The same thing, let's say inflammatory bowel disease, usually diagnosed at the 30 to 40 and incidence is increasing. And it is a definite risk factor for colon cancer. To show that the importance of a person who follow up patient with IBD, these guys are definite having risk for colon cancer. So it's something that shocks to the audience. You know, you have to capture your audience, a target audience for very seriously. You know, you have less than 2 or 3 minutes on the first few slides. You really have to capture their attention. But remember, the audience is looking what's in it for me. So when you present, it's not about yourself. It's not about your achievement. It's not about you know the stuff. You want to present so the audience wants from you the message, the practice in clinical, and so, or the science, so and so. So you have to be very careful. Remember, the audience is looking for what's in it for me. Not, I'm giving the presentation, not for me, actually, for all of you. So formulating strategy, you really have to know the audience. You know, no harm to ask the organizers, who are they coming? Is it mixture of student, GP, so and so? Because expectation from audience are very important. If you don't play it right, they start playing the smartphone and you're just talking to yourself. You know, you have to tailor your presentation, and you know already if the colon cancer screening, not many GP do that. You can give a shocking data for them, and you can also suggest to them, if you give this, you can extra charge your patient because you're sending or giving them the, for example, immunophilicity blood test. You know, you have to be very concrete, very practical to the audience and relevant. So if you go to the GP and you're talking the pathways of vitamin E, the pathways of neuropeptide too heavily, you just shut them down. Okay. So if you're presenting the research, you're very clear your primary objective, secondary objective, hypothesis, methodology, so and so, and really thoroughly, because you're the one who's doing the research. You should know much, much better than your audience. You know, developing the flowing structures, of course, you organize all the information. So you can see on my screen here that really only few lines that I use, and the font has to be mostly more than 24 so that you get a point so people can read and also listen to you. You don't need to go read one by one. The structure, organize all the information in a structured manner. Do not assume this is absolutely rubbish. So, you know, you must know what to give the content to the audience. Okay. Now, when I use annotate, they got a trouble here. So there is always problems. Don't worry. Next. Okay. Okay. So when you have developed the flowing structures, audience might needs to have a basic questions answers. You know, let me just erase this one first. So I think we have to know this thing quite well now. Otherwise, okay. So the audience need to have a basic question answered. You know, if I'm the audience, listen to someone, why I should pay attention to you? What I need to know? What are the interesting data? Now I'm listening. Why should I care about these issues? You know, I think you're giving the misleading or whatever, you know, so how the speakers justify the ideas, you know, so now at the end, am I convinced, you know, so what do I do next? Or is this a good session? I need to follow the speaker for the next presentation, you know. So I think very, very important. See the problem with the Zoom, I just stop here for a minute, go back. This is quite. Don't worry, this is a normal physiological. We just to have handle this thing well. I won't use the annotate anymore. Okay. Dr. Hafiz, can you see the slide?
Yes, Prof.
Yeah, so regularly asking the chairperson cross-check. Otherwise, you'll be talking 10 minutes and you just waste your saliva. So for the next one, common presentation mistake, a pre-presentation. You have no or little presentation preparation whatsoever. So if I want to give today, so usually within 24 to 40 hours, I look at my slide, I check again, I know what are the target audience, you know, I know my time, I have a meeting, so by time 10:49, I should go in. I switch all my brain to focus the presentation. So you must have at least some preparation. And focusing on yourself. If I focus on myself, that is wrong, that is mistake. I need to focus to the audience, what really that you want to know from my presentation. I really have to make sure that there's a clarity of the contents or structures. Now, too much words, information, complex flow is disaster because people are not interested to read on your slide. You have to walk the talk. You have to go step by step to them. Yeah, and you also have lack of creativity or predictable to audience. You know, how you're going to stimulate the audience so that please use this slide, please use this animation, please use this infographic. You know, so I have to think about that so that you guys learn something, and also I'm also still learning. Okay, so at this moment of time, I'm still learning and listening to the presentation by many people, you know, around the world. So you don't want to have a boring presentation, you know, put the blah, 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 flow chart, signaling pathways from here to there, clinical history, investigation. You know that everybody knows, and you not engage with the audience, in particular during virtual. I cannot engage with Prof. Azmi. I cannot engage with Dr. Fitri because that's the way it goes at the moment. But I'm talking about before the era of the COVID. And the slide, it could be too congested, too busy, and too little. And the speaker keep reading the whole words on the slide. I have seen that, even the senior person. This is absolutely appalling. You know, so you must also have some opening, a bit opening of your presentation and the closing. So when you deliver a presentation, whether everywhere to the student or not, half are your body language, but this is the physical presentation. A third, 36% is your voice tonation. And it's only small is what you say, which is wording, which is, I think everybody knows that action speak louder than words. So, you know, moving to the lecture theater, engaging eye contacts with the people, not only in front, but have degrees all over the place in the lecture theater, or even when you present without the slide, you can put on the gallery views so you interact with people. So in the virtual hygiene, now people who are introvert, people who are not talkative, they even feel more frustrated because they are not seen physically by the moderators, by the chairperson, by the speakers, and they keep quiet all the time. So it's good to engage with them, you know, during the virtual presentation. Okay, public speaking is very important. So if the topic like this, no one understand, you know, beyond the just a question for what is this, you know, so this is very simple and not attracting at all. People just say, another sign to discuss about microbiota, so and so. So it's not a good practice. Put a slide which very congested, telling a gut-brain axis for all this eating habit, hormone, and go blah, blah, blah. Who cares? That is for you. That is for me, actually, not for you, which is sometimes wrong. This is commonly seen, commonly presented by the scientists, because we have to be very careful, because that is actually for you, for the presenter. So you really have to know, don't be too congested, don't be too easy. The same thing, you know, all the pathways, for example, this, how the estrogen goes, all this ER beta and go to nucleus and protein expression. So what? Because we can read that from the video, we can copy this from all these plenty images from the Google, but what we want to know specifically to tell to audience is very different, okay? And a simple diagram that you have to do yourself, for example. So in this case, for example, adenocarcinoma, for example, how the normal colon developed to colon cancer, either through this adenoma getting bigger in size, or through this hypoplastic polyp and different type of polyp, you know. So a big diagrammatic, clear instruction, follow the arrows so that people know how the colon cancer arises. Now, the slide design, the big no, no, and no. Look at the red color there. I think you are struggling, so am I. So do not use combination of colors which make it difficult to read. So the audience will be struggling to read that red one. You know, some cases cause eye constraint. Ophthalmologists, I can see Prof. Jemima here. I'm sure she's agree with me. You know, so choose a light color. I was told that I might be wrong. Maybe 15% or 17% are colorblind in any population. So you have to be careful to treat the whole lot. So please use consistent font. Don't use this is a Times New Roman and then use this and it will be upside down. The fonts on the slide should be 24 or above the size, you know, for heading and body. And do not distracting with too much color. You think you good, but it's actually is terrible. And of course, no schizophrenic graphics, which is haywire, which is don't know what's going on. Okay, so that is a thing that you need to know. So avoid, I would say this pretty dull or busy slide. You see the blue slide, you put lung cancer, 1 in every 5. So what? 1/3 death. Oh my God, people can read this in the internet. So you have to put something like shocking data, storytelling, you know, rather than, or you just copy and paste. This is criteria number 2, number 3, blah, blah, blah. Too much info. Who cares? People can do this at home at their sweet time, okay? And if somebody put like this, advertise to audience, I'm not really sure, is it for what, you know, to attend the course, to tell the step, they're just shutting down altogether. So, you know, it looks good. It looks very infographic, technical, but what in it for me is not there for the audience, okay? So, for example, if I want to present something about the cells, I want to get people attention after 20 minutes already. So I might embed the video in this case, for example, how the macrophages eliminating bacteria, you know, so I can write something here, what is going on, you know, so that how the T suppressor cells, white blood cell chasing the bacteria using electron microscopy, for example, you know. So these are the real life, how the macrophages, again, eating the bacteria in the bloodstream. So again, the video may be too loud, you cannot hear me, how the natural killer cells attacking the tumor, you know. So you embedded a little bit the video to simulate people's about the beautiness of the science, what is actually happened in the bloodstream, you know. So this, for example, neuroregeneration, you can see the T suppressor natural killer cell attacking the cancer, for example, you know, not too boring, something that you can think about, something that unique, something that relevant, especially the postgraduate student when you do the lab-based, you know, you see the cells. So I think it will be a fantastic one of the embedment of the videos into the presentation, and how, of course, you have to give credit whoever do that. For example, in this case, Umar Al-Badan, you know, so when you see under the electron microscopy live, how beauty the cells are killing the defense cells, killing all the cancer cells, and these are the use of the chemotherapy, so and so. Maybe none of us see before. So I think that's something that you can share with your audience as part of your presentation, effective presentation skills. Okay, so the better design is, of course, engaging an attractive title. Choose the wow title, 50-50 content rule in your slide. Make sure that you divide about 50-50 at the graphic a little bit, wording a little bit, the photo a little bit, which is very balanced, and not more than 2 thematic key ideas per slide. And on the screen, not more than 6 bullet points there, you know. So use appropriate whatever transition slide animation you can use on the whatever the version of the PowerPoint that you are using. You know, so for example, using a balance of photograph, the pie chart here, look at this, what we call this aspect of the significant PI, combination of clinician and scientists must work together, it works, what does it mean? Look into the future, so not too heavy, it's about 50-50 rule or so. And I think, yeah, it's a pain in the thing to draw a table again. But believe me, too much copy and paste and go to the image Google, people don't like it because that shows the laziness of the speakers. So sometimes the simple thing, like in this case, Child-Pugh score, how to prognosticate patient with liver cirrhosis. So I go walk through all this, again, annotate and show this where exactly so and so, you know, and then another slide, for example. No, this is the problem with the, okay, and then use all this to the audience, engaging them. What does it mean for the class B, you know, the score and blah, blah, blah. And then what do I will see if I perform endoscopy? You can embed the video there or the simple graph, to simple photograph to show the esophageal varices. Now, body language, eye contact, posture, all this thing, the podium rostrum, very important. Again, this is in the context of pre-COVID. Of course, after this, we have to go back again. And speaking style, you know, it doesn't mean that you have to wear the Hugo Boss suit or this expensive thing, but your charisma, how you surprise audience with something that they may not be think, how you use your emotion, storytelling, and embedded a bit about the humor related to the subject, not too much humor, otherwise people said you're not funny and all this thing, you know. So start with a great story, you know, it's a story that really suit to the audience, like postgraduate student, for example, or general practitioner, with a great purpose, and there's a meaningful element of context in that story, you know. So you really have to story from the beginning and middle and to the end. Maybe at the end of the slide is to close what story that you keep telling them, for example. 3 P's, prepare, preview, and practice. You know, we really have to prepare the slide. Don't, a lot of people last minute slide and copy and paste and cut and add on. So you lost the structure, you lost the flow. You know, and preview that and practice and practice and practice. So I still, at the moment, maybe once or twice a week or once or every 2 weeks, still practicing the slide. And now the good thing is that if you attend any meetings, they ask you to get pre-recorded video. Now during the meeting, you are watching your own presentation. Now you know how you scratch your head, how you digging your nasal orifice and you scratch this. So you have to maintain a position so that now you're watching yourself, which has never happened before. I mean, during the physical meeting. You know, your hands movement, not too much, reflects the clarity of thinking that you are pointing out in the points, consolidate the point, and you give the audience confidence, you know, interact with them. And then, of course, as I said to you, effective tonation of the voice, very important. I will know at this stage, if I go, this is monotonous person, oh, this is really high pitch, or this is what, but sometimes you have to make sure high pitch is suitable for that particular occasion or slide, you know, and be memorable, you know. Content is king, but it's not enough, even though the content is super king or whatever that important, but they're not good enough. You really have to deliver with the style, because these are the central, you know, and be a storyteller, not just a typical presenter, you know, the research, blah blah. Really not a pleasant thing. And IT or information technology is supposed to make life our life easier. So use as many as you want. Of course, you have to get ready. Sometimes the IT got stuck, and how you recover yourself, how you can skip that session, you plan, you know, so be different rather than just a typical presentation skills. You know, like Steve Jobs, the late Steve Jobs, really master storyteller. You know, he can create presenting the problems what all the human being has all over the world, and he gives solution during presentation. Make people say, I am going to buy the iPhone instead of the BlackBerry so and so. So really important to have this entertainment during presentation. And ending a presentation, summarize what you have told them. Usually the summary of what you have, in the case of research proposal, you should do that. What message that you can send to the audience. whether you give them more questions or more issue for the research to be done better in the future, whether you say that there's an action to be done in the future, and you really outstandingly different with the other presenters, and you leave the audience want to listen more to your presentation. So these are the effective skill in presentation. Now, before I can guarantee if I've been asked a question, I will tell you whether I'm wrong or not. I will know already who's going to ask the questions and what are the commonest questions that you're going to ask. So I have in back on my mind already 5 to 10 points, but if something that very unexpected, I have no idea. I have to be honest, you know, this era, information technology rapidly transform. Prof. Azmi, the only one who maybe can cope, but many of us may be still lagging behind, you know. So you have to understand. If I do not understand, please, I will ask politely, can you repeat the questions, you know? And if the question thrown to me are really put my nerve or really challenging my emotional intelligence, be cool, relax. Even the very annoying question, they know that sometimes people want to ask the question, he or she may know the answer, he or she just want to test the presenter and want to trickle or want to piss the presenter off. Control your emotion, you know, don't need to entertain at the level of the ask. So be professional, respond professionally. You know, so take home a message summary and to clear conclusion is, again, you have really to capture the attention. Structures is very important. Eliminate the jargon, your passion to present, and conclude on a high note, which is also the one that you have mentioned before this in your presentation. You know, among the checklists are prepare early, think about the audience, be clear about your proposal or your whatever that you asked to deliver the presentation. Effective introduction, you must clearly, the first 2 minutes is the one that you have to prove. If don't, then everybody kind of shut down. Organize clearly and have some data support. Use your own data is better rather than sometimes take from Mayo Clinic, take from Seoul, take from this. Audience want to ask, so what's your contribution in this research area? It's not like you want to show off your paper, but you want to say that all over the world, including our data, also look at these particular points, okay? Of course, create a effective conclusion. Do not read one by one, you know. You have to be spontaneous. You have to be very, what we call it, conversative, very spontaneous to the audience. You know, show your enthusiasticness and use your body language effectively and any visual aid. And, you know, sometimes you're wearing tie and physical maintain too tight. Your hands go to your throat all the time. So be yourself. You know, cope with unexpected, expect the unexpected things, okay? And the PowerPoint tips to improve is, this is PowerPoint. You know, you have to be personal and authentic. You know, sometimes people go and copy the slide of the presenter and we do it again. You have to be very careful because it could be the audience there is the one who presented the things a couple of weeks ago. You know, and you can ask the question, simple diagram, make the audience understand what you're talking about. And of course, I think everybody knows picture is worth 1,000 words. Now, if I want to put the issue for training gastroenterology in Malaysia, rather than just put one word line by line, perspective from training, perspective from trainers, institution, so I can put a diagram, you know, in terms of university academic, and then I just elaborate myself what are the issues, and that is from the preparation that I have to read, you know. So rather than just go one by one, the same thing if I present something about, you know, fecal microbiota transplantation, I don't need to put the sentence. These are the factors leading to the success from the donor point of view, which is species, gender, diet, so and so. I walk the talk or the graph. From the host point of view, again, animal model, and from the preparation point of view, collection of the stools, so and so, and hit the target. So diagrammatic presentation, but you eloquently describe this your subject matter expert rather than just put line by line on the side. Again, is someone like a infographic. What makes a good infographic? So you have to have a combination of data, design, the story, and shareability. So you get these components of infographic, not really congested, not too busy, but it's really useful for the audience to understand, because these are the one that people will snap the photos to keep for their reference. Now, if you go to meeting in international meeting, Europe or US, sometimes you can see here, no photograph is allowed to take, because people can do that and then they can copy, and because the presenter made an effort to make the slide nicely for the presentation, so you just cannot copy what they do. Again, the great ways to learn your message when you present, your physical appearance, dress appropriately, vocal or tonation as your voice, what are the volumes, you ensure that people at the back can also hear you. You have to have, the powerful part is emotional connection with the audience. So if you're talking about the audience are general or cancer survivor, so you must create, if you are the medical doctors, how your storytelling, managing patient with colorectal cancer until that patient receive all the appropriate treatment and die. So you get some emotional connection with the audience or the colleagues on the podium. So sometimes show the powerful image, So these are the image of the brachial artery from the electron microscopy, and the red one is the red blood cells flowing inside. So how often that we see the image like this, So you would like to share with the students or whoever, rather than just typical anatomical blood vessel or this. So you look deep inside. Yes, of course, you can do a video, things like that. Sometimes too much video, sometimes the technical issue, and then you get into trouble. Now, if you want to tell to the audience what are the 8 essential technology that you must know from now for the next 20, 30 years. So these are the PricewaterhouseCoopers that mentioned we really need to know, even though we do medicine or whatever specialty, we need to know a bit what is IoTs, we need to know what is AI, what are the useful clinically for drones, automation, or robots, or 3D. I think we need to go beyond our comfort zone rather than just, your specialties. And sometimes you can tell the person in your presentation using the, again, the diagram or boxes. In this case, for example, Eisenhower matrix, how to make a decision. So you draw the graph, urgency versus importance. So something like urgent and important, you just need to do decision now. So you express that to the audience. If the urgency is not urgent, not important at all, do not waste your time, delete into the bin. No need to think about that, okay? So these are the ways sometimes, rather than just put 5, 6, 7 point there, switch off the individuals. Now, in the era of the virtual presentation, the virtual hygiene has to be done. I'm still learning. I still want to improve myself. These are among the best practices to improve whatever platform that you are going to use. So the very first time I used Zoom back in 2013, so it's about 7 years ago. And before this, I think a lot of us know the Skype so-and-so. So I'll be using Zoom in 2013. So by the time the pandemic, I'm familiar already what it's all about in the, how to change the virtual background so-and-so. But any platform, virtual platform, person or speaker must have virtual hygiene. Number one, get the lighting right. Some people buy, this is a specialty, Prof. Azmi Tamil, get the light close to your desk so that basic table lamp is enough, so lighting a bit to your face rather than very dark. Invest some money to have a decent microphone, so that people can hear you well. And dressing, yes, casual is okay, but is the meeting board of directors or something, so you have to be more professional, maybe wearing ties, wearing a suit, even though virtually. This is simply to show the seriousness of this meeting. And be conscious of your background. Don't put something at background, something that make you like a robot or something, you have to get a green screen, Azmi know very well, be natural, or, you really have to ensure this quite well. Otherwise, if you put some funny thing and people keep focusing on your background and really distract the attention. Your virtual presence. So I'm looking to the camera now, so you can look at me, okay? And sometimes a bit unnatural, you know, we go to here, move up and down. So to maintain to the camera in the virtual hygiene is very difficult because we need to focus on the slide. So sometimes a little bit cheating, people can put something behind the thing to focus the eyes all the time. And your voice should be very as well, you know, so your voice should be very different, something quite easy, something that's striking. So you change the tonation of the voice to keep engaging with your audience. Now, some virtual meeting, you have to stand up. Okay, so this is because of maybe the big international meeting. This indirectly gives you more energy, but most of the time sitting down and things will be fine. Now, very difficult to engage with the audience. How do I want to engage with Prof. Jemimah, Prof. Azmi? I can see their name. I can go Google Dr. Fitri and so-and-so, you know. So make it clear to your attendees that you expect camera to be on. So it's a good for all of them by right should on the camera during any presentation. So Dr. Syed dah buka dah kamera contoh ni kan. Because otherwise the expectation engagement is not there. You know, but if you want to drink, for example, a bit, you know, you can off the camera, is fine, you know. So start with the icebreaker. Still, maybe you don't know the colleagues from US or outside, you know, how you're doing, interacting. And ideally, the speakers, they will put all the speakers, moderator in the holding room, right? So that you interact first before you go to audience, so and so. So, of course, people has to know that the speaker that you on live, otherwise 2,000 people watching you and you're still digging your nose. So you have to be very careful on that. You can use many advanced features. This is the expertise that we all must know, how to do a polling, how to do the chat, how to go to one press button can send to breakout room straight away. No talking. One press button, you can stop the pre-recorded video presentation. Sometimes can be very cool. You know, you can send everywhere. So I think virtual engagement is also very important. Now, presentation style. Sometimes when we do on the podium, on the rostrum, you make sure that if you are wearing the cufflink, your height, your distance of the suit, not overtake this or go to your MCP joints, trying that you don't know how to do this properly, and the matching of the ties, you know. So if Dr. Syed Hafiz wearing the blue now, if he choose the blue tie like this, completely he has no idea about formal matching between the ties and the shirt. So one has to know as well, contrast color like pink with the blue, you know, rather than the length of the tie if you be there. So just right, just at your belt, not too low. If you see a Donald Trump, sometimes too low beyond the pelvic region, which is awful looking. But sometimes people say, I don't really care. Of course, you don't really care. But people will say that, have you been attending professionally or not, this personal appearance of the dressing code? Okay, so shirt and stripe color, you know, this is awful. Why the thing you wearing the tie when your color like this? You know, so you have to be very careful. Nowadays, the new norm dressing code. I have to admit, I do that sometimes, but of course, we don't take a photo. So you can look very professional on the top, but you have to be very careful when you want to go to the toilet off your camera because people knows your short pants. It happened to a senior colleague as well, you know. So perhaps these are the new normal dressing now for the virtual meeting. If you are sitting down all the time, I'm not approval of this. It should wear nicely. But in reality, this is what's happening all over the world. Now, I just screenshot the meeting when I came over here. So for example, now, if I want to put this, what we call this drawing, for example, you can see Dato' Zul appearance not as high as like Prof. Laila, not as high as Prof. Noor Azlina or Prof. Tan. So there's a space here. So he totally head and neck only on the screen, right? So not a good thing. Sometimes you see I'm not looking to the camera and Prof. Tong doing something. So these are, for example, things that we have to watch. We will watch this when we look at our presentation, which is sometimes not good, So we really have to be. So lastly, can you see my screen?
No, Prof.
No. So lastly, it's quite common. So this is my last slide. Present, speak in such a way that others love to listen and to learn from you. And listen to such a way that others love to speak to you. Okay. With that, I thank you, Dr. Syafiq, for the attention. Thank you.
Thank you so much to Professor Dr. Rajat Effendi for a very nice and enlightening, astonishing presentations, I would say. So we have got two questions, Prof, in the chat box.
Yeah.
So I just read it out. First one, Assalamualaikum, Prof. What is your opinion if we include video in our postgrad viva and during oral competition in a conference?
Thank you. Number one, you need to know the rule of the university allowing present the video or not. Number two, during the viva, you also need to know the rules and regulation presenting the video or not. But many international meeting, young investigator award, so and so, that is depend on your skills. So if they allowed, why not? But the video has to be edited, cut very nicely, not 10 minutes, not 10 seconds, and has to be relevant to the subject. At this moment of time, the TRGS in the KPT, they want us to show 3 to 5 minutes video rather than just go presenting. So it is relevant, but make sure that appropriate and you don't break the rule of attending viva so-and-so.
Right, so the next one, Prof, I love to do this kind of Steve Jobs style of presentation, especially to the public. I've done quite a few to good receptions. However, is this style suitable for a thesis proposal presentations or a CME with quite a heavy topic?
Yeah, so thesis presentation and general presentation are very different. So thesis presentation on the first few slides, when you put introduction is about you put the shocking data. Introduction, you put about something that's super interesting, catching the eye of people who listen to you. Not just, for example, you go to lung cancer. Lung cancer is the first cancer in man in Asia. Lung cancer is the third cancer killing people. That is pretty boring. Who cares? I can read that. Audience can read that. Remember what is it for me? So you have to put such a way that it is within the thesis proposal, but how you wow if you get the audience or the supervisors, the people who are evaluating your research progress. So these are the skills that you need to learn. You don't want, Steve Jobs are very different because there is, look at the BlackBerry, so-and-so, but the tonation, the style is there, how you translate it into the thesis proposal.
So I think that's all the question that we have at the moment, Prof.
Okay.
So thank you so much again on the behalf of the committee members. I would like to thank Prof for your precious times and for sharing us and unpack all these effective communication skills. Okay, thank you so much, Prof.
Thank you. Welcome.
All right, so moving on next, we're going to have a forum session which will be separating into two parts in which we have clinical and also preclinical categories. And I believe all of you have received the link for the clinical. You can stay in this link, whereas for the preclinical, you can go to the link that provided to you. So before we take a break for 10 minutes, let me just introduce the moderator for each sessions. So for clinical categories, we're going to have Professor Dr. Dayang Anita Abdul Aziz, who is the first woman professor of pediatric surgery in Malaysia and the first woman to lead pediatric surgery services in academic institution in Malaysia. She obtained basic medical sciences from UKM in 1992 and graduated with MD UKM in 1995. She passed as fellow of RCS Edinburgh in UK in 1999 and started specializing in pediatric surgery in 2001 under Ministry of Health Malaysia. In 2003, she was sent to UK and Australia for sub-specializations in pediatric laparoscopy. She completed her training as fellow in pediatric laparoscopy from WCH Adelaide, Australia in 2005 and joined UKM in October 2007 as Senior Fellow in Pediatric Surgery. She was instrumental for development of Advanced Surgical Skills Center and the installations of 4 fully integrated high-definition STORZ operating theatre at UKM Medical Center, as well as developing UKMMC as a center for advanced pediatric and neonatal minimally invasive surgery MIS. In September 2011, she took over as head of pediatric surgery at UKMMC, and Prof. Dayang Aziz has performed many historic MIS in neonates in children. So I think I stop there, and you can read the rest of the biography as shown in the slide. So Prof. Dayang will be moderate the session for the clinical forums, whereas for the preclinical forum, we're going to have Professor Dr. Susanna Makpul from the Department of Biochemistry, UKM. She graduated from UKM with a Bachelor of Science honor in Clinical Biochemistry in 1992 and obtained her PhD from the same university in 1997. She then went to Graduate School of Pharmaceutical Sciences, Hokkaido University, Hokkaido, Japan in year 2000, and Linus Pauling Institute, Oregon State University, Oregon, the USA in 2008 for research attachment. She was the head of biochemistry department from 2011 till 2018 and currently the head of aging and degenerative disease research group. Throughout her service, she has been awarded several awards such as Excellent Publication Award in 2019 and Excellent Service Awards in various years, as you can see in the slides. And in 2016, she was awarded Pingat Johan Setia Mahkota by Seri Paduka Baginda Yang di-Pertuan Agong. So Prof. Susanna will be moderated preclinical session forum this afternoon. So we're going to take a break and we'll resume the session at 12 p.m. So for those of you who would like to stay in the clinical categories, you can remain in the group. Whereas for those who would like to go for the preclinical categories, you can go to the link that has been provided to you. All right. So thank you so much. So have a good rest.